Lovenox. Introduction. Thinned blood clots faster than normal blood. Select true or false. Correct. Thinned blood clots more slowly. Lovenox is a blood thinner. If you miss a dose of Lovenox and remember it when it is time for the next dose, you should not take a double dose. Select true or false. Correct. Increasing the dosage of Lovenox can cause complications such as bleeding that is difficult to stop. Lovenox is injected directly into the blood. Select true or false. Correct. Lovenox is injected in the fat below the skin. That is why you will be asked to inject it in the areas of your body with a layer of fat, such as the fatty tissue of your belly between your belly button and your hips. You should use a different site of the stomach each time you give yourself a Lovenox shot. Select true or false. Correct. For instance, if your last shot was on the right, give yourself a shot on the left side of the abdomen for the next shot. Syringe and needles should be disposed of in a biohazardous waste sharps container. Select true or false. Correct. If the patient using the Lovenox shot has a blood-borne infection such as HIV or hepatitis, these infections can be transmitted to family members and friends if they accidentally stick themselves with the needle of a discarded Lovenox syringe. If this happens, the person needs to seek urgent medical care for evaluation and possible treatment. Minor bruises are a normal side effect and do not require that you call your healthcare provider. Select true or false. Correct. Minor bruises are normal and do not require your healthcare provider's attention. But large areas of bruising or unusual bruising are not normal, and you should call your healthcare provider if they happen. Serious side effects of Lovenox are common. Select true or false. Correct. The serious or adverse side effects of Lovenox are rare. Thank you for using Explain.